What types of magnesium are beneficial for sleep? There's oxide, there's citrate, there's L-threonate, there's glycinate. Let's figure all this out. Watch this video to the end and I'll tell you about the products that might be able to significantly replace these supplements if you eat properly. The pharmaceutical industry produces a huge amount of different types of magnesium. The oldest such preparation is magnesium oxide, which is still partially used as a so-called antacid, a preparation that removes excess acidity. Although, of course, much more powerful preparations have now appeared, which simply block the formation of acid. But such antacid preparations still contain magnesium oxide. Previously, it was used before modern formulas, especially for magnesium deficiency. The daily norm of magnesium is approximately 400 milligrams for men and 300 milligrams for women. Why do we have a deficiency? There are American studies that have shown that in the 19th century, the average American, consuming predominantly plant food, consumed about 400 milligrams of magnesium per day. And this essentially was the norm, which is now featured in all clinical guidelines. In the 20th century, the consumption of magnesium already decreased to 200 milligrams because Americans switched to fast food, processed food, and all other countries followed them. Actually, I think we are not far behind in terms of fast food consumption from the same Americans. And the magnesium deficiency has become a significantly more important problem for healthcare and for people themselves, of course, as well. It's alarming to consider the possible 21st century repercussions if magnesium consumption continues to decline, potentially reaching just 100 milligrams through our diet. Although I will say, in some American states, it is directly required by law to additionally enrich the bottled drinking water with magnesium, so to speak, to compensate for the magnesium deficiency in the diet. That is, even without any additional supplements, if a person drinks the appropriate drinking water, buying bottles, he is already additionally enriched with magnesium, compensating for the lack of magnesium in the diet. I heard that people who are weather dependent need to drink magnesium, then they won't feel it all. Is that so? The question is how significant a role the placebo effect plays. If a person believes that the magnet helps him with everything, well, it really participates in 300 processes in the body, various metabolic, biochemical, and so on, and it can really help with stress, for example, improve mood, improve sleep quality. And if we consider the use of magnesium in this sense, I think it will have such a positive effect, and in relation to weather-dependent people, who will also get some real benefit, plus an additional placebo effect. Likely taking magnesium will be beneficial. Who it passed, the storm didn't affect. Well, before we move on to the so-called chelate forms, let's remember about magnesium citrate. It is predominantly in large doses, especially if taken. It is used as a saline laxative. So you see, magnesium is so versatile that it is used both as an antacid for acid production and as a laxative. But still, these modern chelated forms of magnesium are now used as replacement therapy. This is mainly magnesium glycinate and L-threonate magnesium. What are chelated forms generally? This is when magnesium is chemically combined with an amino acid. And from Latin, chelate means claw. Well, visually, this is the formula that results. And that's why such chelate, such claw-like formations, they are much better absorbed, because both absorption is better and penetration into the brain also occurs better. Actually, we have two main forms of chelate. This is L-threonate magnesium and this is glycinate magnesium. When is the appointment shown? First of all, when a person is given tests and we really see a decrease in the amount of magnesium in the blood. Typically, these are already substantial deficits. And who has them? They occur in people with gastrointestinal diseases when magnesium is poorly absorbed. They occur in diabetes. By the way, patients who abuse alcohol often have a pronounced magnesium deficiency. That is, in this situation, magnesium is absolutely indicated to compensate for its deficiency. Even with normal blood magnesium levels, it doesn't guarantee sufficient magnesium in the cell and brain. Because when we live in big cities, we have a lot of so-called pollutants. For instance, exhaust gases like carbon monoxide disrupt metabolic processes in the body. Even though there might be an adequate amount of magnesium in the blood plasma, it may still be insufficient in the cell because it doesn't reach there effectively. And in general, if we see problems with some let's say, diseases with the same insomnia, then here is shown the purpose of magnesium, because there are works that really talk about the fact that the appointment of magnesium in therapeutic doses of 400 mg or even 500 mg per day improves sleep, improves the quality of sleep, reduces the degree of anxiety. In particular, this is also close to somnology, the so-called restless leg syndrome or periodic limb movement syndrome in sleep. This is when a person has indescribable but extremely unpleasant feelings in the legs before sleep, forcing to move and interfering with falling asleep. And also, a lack of magnesium can intensify the restless leg syndrome or periodic limb movement syndrome in sleep when a person is sleeping and his legs twitch several hundred times a night, accordingly deteriorating the structure and quality of sleep. So, yes, indeed, magnesium is in the arsenal of a sleep doctor, and we take it as some kind of therapeutic and preventive measure when we normalize the quality of sleep, especially if these are not very serious disorders. Maybe sometimes prescribing vitamin formulas, multivitamin formulas, this significantly improves the quality of sleep without prescribing any serious other drugs, hypnotics, tranquilizers, or antidepressants. So, once again, if you have problems with sleep, then having consulted with a doctor and again having done a test, it is always purposeful to do this, because depending on this, the dosages can be different. You can use magnesium preparations, especially chelate forms, which are well absorbed and which can improve both the quality of sleep and reduce the level of anxiety. Some even have an antidepressant effect and in principle improve the quality of life. But it's clear that there are quite simple or not severe sleep disorders with which it is possible to cope with some behavioral things, or for example, the prescription of the same vitamins, microelements, and so on. But still, if a person suffers from serious, especially chronic insomnia, and is already taking medications, they may not be effective enough, then in this situation, it is necessary to treat the person. There are two methods. The first is the pharmacological application of drugs. The second, which is now essentially the main treatment for chronic insomnia, is cognitive behavioral therapy for insomnia. This is now the first line of treatment for insomnia in virtually all clinical recommendations around the world. I implement a cognitive behavioral therapy program that allows most patients with chronic insomnia to be cured in a month and a half without prescribing drugs or even allowing them to cancel the drugs. But this, of course, requires certain efforts from a person. At the same time, I would say it pays off in the long run because first, we cure insomnia, and second, we do not prescribe or even cancel drugs. In the description of this video, you can find a link to this program. If you have this insomnia, let's say you suffer from it and the drugs are no longer helping, contact me. I can effectively help you. And I promised you I would talk about products that are rich in magnesium. And if you consume them in sufficient quantities, then no supplements will be needed. First of all, these are large green leaves, spinach, cabbage. These are various fruits. These are nuts and seeds, almonds, cashews, sunflower seeds. Pumpkin also contains a lot of magnesium. These are legumes, beans, chickpeas, lentils, whole grains, brown rice, quinoa, oats. And if you have a balanced diet with a sufficient amount of such products, then you will be fine with magnesium. Which of these products do you regularly consume in your diet? Please write in the comments. Don't forget to subscribe to my channel. There's a lot of interesting information about sleep here. And click on the bell so you don't miss my new interesting videos.